You had mentioned in French that your message in December about avoiding ERs maybe didn't go as well as you had anticipated, or did not wasn't reached the way you wanted it to. Can you talk about the criticism? Are you concerned that it was it warranted? Do you think that the messaging needed to be better?
Well, I think when we came in December, we were clear that we were expecting to be difficult. The bad news, it was difficult. I mean, there is no. I don't think it's a question of message. It's a question that, and that's the reason we're publishing some statistics today, very clear to see that the the goodwill of the people that we're receiving are older. They are in greater number, absolute number, and you've seen that table that we've made available. So I think that the second message is that it's going to be difficult also for the next 2 months. That's exactly what Dr. Boileau has said, because maybe COVID is not as bad, but influenza is still going up. It's still going up. And if there is a clear message on influenza, uh, vaccination is still a possibility, because we have only almost 50% of the population that is more vulnerable than above 65, 70 years old that could be vaccinated. A difference of 10, 15% make a huge difference at the AR. So two message. It was difficult, but it's gonna be continue to be difficult in the next few weeks, few months. So let's make sure that we protect ourselves, either in prevention or vaccination.
But in terms of avoiding the ER, is that something that you thought was
want me to
taking the wrong
answer?
way?
Sure, sure.
Monsieur Boucher,
Yeah,
Boucher, you
so I'll just first of all, we every time we ask people not to come to the emergency, we also mention that if you feel sick, if you're not well, we are there for you. We're sorry if that wasn't clear, but people have to understand we are there for the sickest patients all the time, 24/7. Secondly, most people making those comments are from other provinces, Ottawa, Vancouver. I don't think they're facing 200 and 250% congestion. I don't think they have waiting room of 110 patients, and they don't see 50% of their waiting room leaving without seeing a doctor. So yes, it's definitely not something we want to say when you're 100, 120%, but in face of the congestion we're facing right now, we decided to ask everybody to help us a little bit. We made that message to the population. The people, I can tell, emergency doctors agree with the comments that it's not by having less viruses in the waiting room that we're going to decrease the occupancy of beds in the emergency, but it's part of what the population can do to help us. In the meetings, we talk about flow of hospital flow. How can we take people out of bed? How can we treat people without using a bed? Can we get them out of the hospital faster? What can we implement so that we have more access to bed? Those are the discussion we have in our meetings. But yes, we did pass on. We just asked the population to help us a little bit too.